Imagine this. Your patient is already sitting in the dental chair. Your assistant is ready. The treatment room is prepared. But you're still reviewing X-rays, checking medical history, updating notes, or answering a question at the front desk. By the time treatment actually begins, several valuable minutes have already disappeared. Now multiply those minutes by every patient, every day. Those small delays can turn into longer waiting times, a more stressful schedule, and less time for actual patient care. And I'm not talking about rushing dental treatment. Great dentistry should never be rushed. I'm talking about eliminating the repetitive tasks and administrative delays that slow everything down. That's where AI can make a real difference. Today, let's look at 3 practical AI automations that can help dental practices save time without replacing the people who provide patient care. The first is AI-assisted radiology. Imagine a new patient arrives with tooth sensitivity. You open the X-rays and start reviewing them. You zoom in, adjust the image, check different surfaces, and look for anything that might need closer attention. During a busy day, that process takes time and concentration. AI-assisted imaging tools can help by analyzing dental images and highlighting areas that may deserve a closer look. It might identify patterns associated with possible caries, bone-level changes, or other findings that require further evaluation. But here's the important part. The AI isn't making the final diagnosis. It's assisting the dentist. Think of it as another set of eyes saying, "Take a closer look at this area." The clinical decision still belongs to the qualified dental professional. And there's another major benefit. Patient communication. An X-ray can look like a confusing collection of gray shapes to a patient. But when an area of concern is clearly highlighted, it becomes much easier to explain what you're seeing. Instead of simply telling the patient there's a problem, you can show them. The conversation becomes clearer, and patients can better understand the information you're discussing with them. That's where AI becomes genuinely useful. It doesn't replace the dentist. It helps the dentist communicate more effectively. Now let's talk about something almost every dentist knows, and almost nobody enjoys. Documentation. The procedure ends, but the work isn't finished. You still have to write clinical notes, document findings, update records, and record recommendations. A few minutes after every appointment might not sound like much, but across an entire day, those minutes can become hours. This is where AI voice charting can help. Imagine finishing a procedure and simply describing what happened. You explain the treatment performed, the findings, the materials used, and the post-operative instructions. The AI converts that information into a structured draft. You review it, correct anything necessary, approve it, and move on. That's a much better use of technology than spending your time typing everything manually. And remember, AI prepares the draft. You remain responsible for reviewing and approving the final clinical record. The real benefit isn't just saving a few minutes, it's reducing interruptions. Every time you stop what you're doing, walk to a computer, type notes, and then switch your attention back to the patient, your workflow becomes less efficient. With voice-based documentation, the process can become much smoother. Less repetitive typing, less paperwork, more attention for the patient. And those small improvements can add up throughout the day. Now let's look at the third automation. Intelligent patient intake. A new patient arrives. They're handed forms for medical history, consent, insurance information, and contact details. Then your team has to review everything manually. Maybe something is incomplete. Maybe important information is missing. Maybe the handwriting is difficult to understand. And suddenly, the appointment starts late. Not because of treatment, because of paperwork. A digital intake system can move much of that process before the patient even arrives. Patients can complete secure forms from their phone, tablet, or computer. Your team can review the information ahead of time. Missing details can be identified earlier, and when the patient walks into the clinic, your team is already prepared. Instead of spending the first few minutes collecting basic information, you can move into the actual clinical conversation sooner. That's better for the patient and better for the entire team. Now imagine making every appointment just a little more efficient. A few minutes saved here, a few minutes saved there, across dozens of appointments. Those minutes start adding up. Waiting times can decrease. Your schedule can become more predictable. Your team spends less time chasing paperwork, and you spend more time doing the work that only a dentist can do. But here's where many clinics make a mistake. They try to implement everything at once. They discover AI-assisted radiology, voice charting, patient intake, scheduling, marketing automation. And suddenly, they subscribe to 5 different platforms. Now, the team has new software, new workflows, new passwords, and a lot of new things to learn. Instead of improving efficiency, everything becomes more complicated. So don't try to become the most automated clinic overnight. Start with your biggest bottleneck. Ask yourself one simple question. What's slowing my clinic down the most right now? If image review takes too long, start there. If documentation is consuming hours, start with voice charting. If appointments are being delayed by paperwork, improve patient intake. Choose the technology based on the problem, not because the software is popular. And give your team time to adapt. Run a small pilot. Choose one dentist, one assistant, or even one treatment room. Test the workflow. Listen to feedback. Fix the problems, then expand. Because AI doesn't transform a clinic by itself. People do. And finally, measure the results. Don't just ask, do we like the software? Ask better questions. Are appointments starting on time more often? Are clinical notes taking less time? Has administrative work decreased? Are patients understanding treatment discussions more clearly? Are dentists spending more time with patients and less time behind a computer? Those are the numbers that actually matter. Because AI isn't valuable just because it's impressive. It should create measurable value for your practice. And here's the bigger picture. AI isn't here to make dentists work faster. It's here to remove the things that slow great dentists down. Patients don't choose a dental clinic because its software is impressive. They choose it because they trust the people inside it. They trust the dentist. They trust the team. They trust the care they receive. AI should strengthen that experience, not replace it. So if you're just getting started, keep it simple. Choose one automation. Master it. Measure the results. Train your team. Build confidence. Then move to the next improvement. Because the most successful dental practices don't transform overnight. They improve one workflow at a time. One system at a time. One patient experience at a time. So let's quickly recap. AI-assisted radiology can help dentists review images more efficiently. AI voice charting can reduce repetitive documentation. And intelligent patient intake can prepare patient information before the appointment. None of these tools replace your expertise. They simply give you more time to use it. And in dentistry, time is one of your most valuable assets. Now I'd like to hear from you. If you could automate just one part of your dental workflow tomorrow, what would it be? Radiographs? Clinical notes? Patient intake? Scheduling? Or something completely different? Leave your answer in the comments below. And if you found this video helpful, give it a thumbs up and subscribe for more practical content about dental AI, automation, digital dentistry, and practice growth. And remember, the future of dentistry doesn't belong to the clinics with the most technology. It belongs to the clinics that use technology to deliver better patient care. Thanks for watching. I'll see you in the next video.